This is Zen'n'ish.
Hi, this is Dr. KiKiin, and today we will be discussing Black male mental health. This is a very important topic and one that I think we don't discuss enough. And in this time with everything that's going on, it's definitely something that we need to pay attention to and shed some light on. Today we have a wonderful panel with us, and I'd like to introduce them at this time. We have Dr. Alan Lipscomb, and he is an assistant professor, a researcher, and clinical practitioner who works at California State University Northridge in the Department of Social Work. His area of expertise is centered around the psychiatric epidemiology among racialized Black men across the Black diaspora within the United States who have experienced trauma, specifically exploring grief reactions among Black men in the United States. The title of his book is Black Male Grief Reaction to Trauma, a clinical case study of one man's mental health treatment. So welcome. Thank you for being with us today.
Thank you for having me. Excited to be here.
We also have Mr. Robert Ellington, and Mr. Ellington is a success coach who is employed with Halos, and his area of expertise centers on assisting kinship families and life skills for children and teens. We're glad to have you, Mr. Ellington.
Thanks for having me.
All right, and we also have Dr. Mario Jackson, and he is a higher education consultant who is the CEO of Jackson Educational Consulting Group, LLC, and his area of expertise is teaching higher education institutions how to integrate the concept of thought work into their faculty and staff development initiatives. So welcome, Dr. Jackson.
Thank you so much for having me.
And we're also very happy to have Dr. Daphne Watkins. And Dr. Watkins is a professor and director of the Center for Health Equity, Research and Training at the University of Michigan. Dr. Watkins is a behavioral health scientist who specializes in research on within-group differences among Black men. And her work highlights the importance of specific programs that improve mental health, manhood, and social support for young Black men. Welcome, Dr. Watkins.
Thank you. Very happy to be here.
Awesome. So let's kind of jump right in here. And I'm going to reference an article that was written February 2019 by Thomas A. Vance. And Dr. Vance addresses mental health in the Black community. So we're going to start a little broad, and then we're going to narrow down into Black male mental health. And he states that research suggests that the adult Black community is 20% more likely to experience serious mental health problems, such as major depressive disorder or generalized anxiety disorder. And young Black adults age 18 to 25 also experience higher rates of mental health problems and lower rates of mental health service utilization compared to white young adults and older Black adults. He further states that further research is required to clarify these findings and to understand the factors associated with lower utilization of mental health care among the Black community. And let's talk about this a bit. What are some of the reasons that you think contribute to the lower utilization of mental health care amongst the Black community? And we'll start with Dr. Lipscomb.
Sure. I think there's a couple of factors that play into this. One of the things that I have found is that there is a need for Black communities, Black folks to receive mental health support, but because of the long history of mistreatment in healthcare settings and institutions, we see that they are leery and accessing those types of services. While they are seeking some type of support, it's just not in the traditional Western European ways of receiving services and mental health support. So they're receiving that through kinship. They're receiving that through their church community, etc. So they access it, but it just looks different because of that long history.
Okay. And you did mention kinship, and I know that that's something that Mr. Ellington works with. Mr. Ellington, can you tell us a little bit about kinship? What is that? What does that look like?
Kinship is any relationship where, children and families are all connected. Like he said, like not necessarily in the Western, by the Western definition of the nuclear family. This could be grandma, this could be auntie, this could be uncle with children, taking care of children, no matter what the circumstances may be. But a lot of people, they look for supports within that network, and they feel like that should be enough. And there's also that whole stigma about mental health, and oh, well, we'll just pray about it, or the whole stigma of not being strong, like there's some kind of weakness if there's something going on mentally or emotionally. So there's a lot of that I see it all the time, and sometimes I work with families who are in that position, like where granny is taking care of children because mom or dad is going through something. That's what they always say. They're going through something. And, when you start digging and talking and talking and talking, you realize that something is mental illness. Mm-hmm. But it's like they don't want to say it. They don't want to really go there. They're like, oh, we'll pray about it. But have you gone, therapy isn't a bad thing. So there's a lot of the stigma that we have to get past. I think we're in a better place than we were, 10 years ago, but there's still some work.
Yes. And I think bringing up stigma is a huge part of it. And I wonder if the stigma is just thinking that we can pray through it, or we have to be strong enough to get through it, or if there really is a lack of understanding about what mental health and mental health challenges really are. Dr. Watson, would you like to weigh in on that?
Well, yeah, I think there is a stigma associated with all of these challenges, but I also think we have to do a better job of normalizing seeking help for these kinds of challenges. I think, just as what was said earlier, we tend to not do that. We tend to just handle it on our own, thinking about, what are the implications if someone happens to see my weakness? Mm-hmm. And this is speaking broadly about the Black community in general. So I know the topic of this panel is to talk about Black men's mental health, but I would even go as far as to say that these are some of the challenges that Black women face too. Do I want to show my weaknesses and go in and seek help when I'm supposed to be the backbone of the community or the backbone of the family?
Yes.
So I think, going back to my earlier point, we just have to do a better job of normalizing help seeking and normalizing the fact that if someone does need help for any kind of challenge, that it's not seen as a weakness or that they're lesser of a person because they're making the decision to actually try to do something about whatever it is they're experiencing.
Mm-hmm. Yes. And Dr. Jackson?
I think Dr. Watson and the other panelists have made really good points about the attitudes towards receiving mental health for Black males. I think a part of what's driving some of these attitudes is also just a basic sense of trust of the medical system in general.
Yes.
So it's really not a secret anymore that it's here in the United States. There's a really dark history of experimentation on Black males and females for the sake of research. So I think that those situations have not been forgotten, and they are deeply ingrained into the mentality of the Black community, and particularly males, about reaching out to the medical community, whether it's for a physical or a mental condition for help. There's just a lot of mistrust there that could be driving some of these attitudes.
Yes, and I think that the history, that wound is often open. I think about a recent article I read where two French doctors were discussing on live television about cures for COVID, and they thought a great place to test it was in the African community. And when you have that type of thing happening in 2020, then you can see where some of those same sentiments from the past resonate today. and why there is that distrust. So what are some ways that, or some other ways that you see the issues with mental health manifesting specifically within the Black male community? Like, what are some of the challenges that we are seeing today? We talked about the fact that it is better than it was before, but what are some of the challenges that are still quite prevalent today?
I think some of the same stuff that we were just touching on in general, speaking of the African American community. One of the things that I found when I moved from community-based mental health practice to a more private practice setting is that I started to see more, and I'm in Los Angeles, California. I started to see more men of color, Black men coming in to get services. And I would hear things like aggression, was one of the referrals, intimacy, relationship, fidelity, infidelity issues were some of it. But then as I started to explore and unpack that and really started to research this, I noticed that there was an underlying theme of unresolved losses that kept coming up. And so one of the things that I started to look into, because I wanted to better understand how to work with this, is this idea of unresolved loss and grief that starts to look like other things, that we don't automatically see it as such. And if I may back out a little bit, that's what drove me into the research that I started to do, because I didn't find research that talked about what treatment looks like, what services look like for Black men who are grieving. And then that starts to go deeper around, trauma and stuff like that.
Yeah, and I do want to get into some of that, the actual treatment part of it, a little later in our discussion. But in talking about that, I want to delve a little more into that. When we're looking at, you talked about how grief manifests in other ways. Can we talk a little more about that, and across the panel, like in what ways are you seeing that to ring true?
Well, this is Daphne Watkins. I would argue that for me, the elephant in the room is issues around masculinity and how Black men are defining themselves as men. And I think for me, this is sort of the thread that tends to just go all throughout mental health, mental illness, and how Black men are presenting themselves in their communities. And what's interesting is that it's almost one of those things that I feel like if we really sit down and start to unpack some of the challenges that Black men are having around being able to express themselves, or as what was mentioned, sort of this unresolved grief, a lot of it is how they present themselves to the world and how they want the world to receive them, I mean, because a lot of the men that I tend to work with in my community-based interventions will just flat out tell me, like, I don't want to be seen as a punk. I don't want to be treated as a punk. So even though there are some things that may have happened to me as a child or as a young adult, trauma, loss, whatever the case may be, I have to bottle that up, and I have to wear this mask, and I have to go out of my house every day with this mask on. And if I don't, then I'll already have, I already have so many shots against me for being a Black man in general, but this will be yet one more shot against me if someone thinks that I'm weak or unable to handle what's been given me in the world.
Good point.
Definitely.
And I want to ask the question, simply having to wear or feeling that you have to wear the mask, does that in itself create grief?
So I would defer to our distinguished Black male panelists here.
If I may jump in here for a second, because I think Dr. Watson, she definitely called out the elephant in the room, but I'd like to name the elephant. And I think what we're talking about is toxic masculinity. So when we are as Black men, and this is not necessarily gender specific because this applies to women as well, but when we have to think about these rigid values of what it means to be a male, a Black male, and then you add on subfactor from the South or from the city or from my block or from my hood, you have this long list of things that you're supposed to be. So I just believe that, as the panelists are indicating, that when there's this disconnect between what's inside and what's expected from the external world, that could be a source of grief because there's a loss of sense of self, right?
That part.
There's not a true sense of identity, and there's just this facade of going through life every day, living up to other people's expectations of who you're supposed to be as a Black male.
Definitely. Definitely.
Very well said. Very well said.
Yes. And therein lies that unresolved stuff, right? Therein lies that grief, that not being able to, and taking the points that Dr. Watkins and Dr. Jackson just brought up, and looking at the history, the historical pieces specifically around Black men having to or being in unique situations and settings over years that supports that type of masculinity, toxic masculinity, only complicates when we talk about the unpacking of the mental health and the grief, etc.
I got to say that I was recently working with a family, and it's an auntie who's taking care of a niece and a nephew, and her nephew is all of 6 years old, and he had a meltdown and he was crying, and this auntie said to me, "Why is he crying? I want him to be a man. He's 6 years old." And I really, we just started working together, so I'm trying to ease into some of the gender role discussion and all those things, because she's got this archaic idea about what a 6-year-old boy who's crying because he's upset, that's a problem, and that's starting. And if he's being told that he's not supposed to cry because he's a boy, what does that turn into when he's a teenager and when he's a man? It's frustrating.
Yeah. Just wanted to jump in and actually kind of just dovetail off of that and to what has been said just about our use of the term toxic masculinity. And maybe I'm going to out myself here, but I'm actually not a huge fan of that term at all, because I feel like in so many ways it labels a type of male profile that may often get attached to men of color. And so I actually try not to think, I try not to think of masculinity in terms of toxic or positive or negative, but I try to tend to think of masculinity in the plural form, masculinities, right? And there's this continuum on which different behaviors and characteristics fall. And so I would just urge us and caution us to think about, even though it helps us understand some negative gender norms and negative gender behaviors, to think about some features, some characteristics of masculinity as toxic, I would just caution us, particularly as people of color, that sometimes when we talk about masculinity in that way, and for many of us who already work with Black men, people just automatically default to thinking about toxic masculinity as being associated with Black men. And so I will rarely use that term. I'll talk about masculinities upon, there's this continuum upon which various forms and demonstrations of masculinity may fall. And during any point in a Black male's life, from young adult, from childhood to old age, he may dabble in any of those places on the continuum. You know what I mean? Yes. So I just want to throw that out there as just something to think about as we think about these labels, right? Like, I think our communities are already labeled enough.
Yes.
And so I would really urge us to think about how we're labeling, Black men and men of color. I feel like whenever I would say the word toxic, being a Black woman, I felt like people say, oh, she must be talking about her brother, her father, her dad. And so I had to sort of even look at myself and how I was, not intentionally trying to put this negative label on the Black men and boys in my life, but just the fact that the words came out of my mouth, people assumed they knew what I was talking about.
That's a very good point. And I think about the fact that when you do look at the spectrum of masculinity, even what some may deem as quote unquote toxic, at some point in time, it was necessary and it served a purpose. Along the way, our times, our society, our environment, our conditions have changed. and we are allowed to feel and be more free with who we are and what we experience and how we experience those things. But we haven't learned, or a large part of our community hasn't learned how to move with those times.
And adapt, yeah.
And adapt. So they are teaching what
definitely.
they know. So, I know this to be how to survive. And, right or wrong, a lot of us in our community, for good reason, are still stuck in a place of, we need to survive. We need to, make it. And this is how I know that we've made it from before. So this is what I'm teaching to my child now, and even like a sense of fear of stepping outside of that. Does my child have the same privilege as someone else to be able to step outside of that?
Yeah.
So looking at it in those terms as well.
And I think, Dr. Kiki, I think you're getting kind of the heart of what I do in working with the concept of thought work. So, this concept is based in cognitive psychology, which simply defines being able to empower yourself to choose the thoughts that produce the outcomes you want in your life. So I think that when we're talking about masculinities, which I love that concept that Dr. Watson threw on the table there, that we have to start a rethink not only at the individual level with as Black males, but it's a societal level. Right? We're all talking about how those things, those ideas and beliefs worked for us in the past. They no longer serve us, right? Because if that were the case, we wouldn't have so many people, Black males namely, who are in pain and suffering because of this dissonance between who they are on the inside and who they are expected to be on the outside world. And just briefly, I wanted to go back to the example the panelists shared about the 6-year-old boy. And just pause there for a moment, because I think that's an excellent example in where there is an arrested development. A part of that little boy could have died that day. Like seriously, his personality just would not even form the same way. He's exposed to that from his aunt. So I think that's just, it underscores how these ideologies about Black masculinity can be damaging and how they can be hurtful to especially the young Black males who are trying to figure out who they are as children and not being nurtured to explore and really go forward with what they feel on the inside to make sure that's who they present themselves to the world to be.
And even, definitely from the inside, but what they're seeing reflected in the world around them. It's no longer, where we are just a community, a Black community, isolated, separate, alone. We are exposed to all of the myriad of other people, cultures, traditions. And so we see that there are other ways of being in the world and succeeding. So why can I not have a part of that? Why can I not be a part of that as well?
And there's that lost piece again, right? And I love what Dr. Jackson highlighted too, because therein lies the genesis of the lost experience, if you will, with the 6-year-old example. And one of the things that I talk about and I found in my work is this idea of forced cultural acceptance around Black men specifically, since we're talking about them, being forced to accept conditions and situations that would not be acceptable if it were not for systems of oppression, folks buying into this dominant narrative that you can't express yourselves. And so when it's time to actually feel something and unpack something, what we hear is things like, it's good, it is what it is, I'm cool, I'm straight, because they've been conditioned to accept situations and conditions that is not acceptable, and you should have feelings, and it's important, it's okay to have feelings around what's happening and what's going on.
And I think that also speaks to what you were talking about earlier, because you're like, I'm good, I'm straight, I got it, but you don't, and those emotions are still there. What happens to them? They will manifest in some way. And so that's when we start to see the other ways in which that grief, that loss, that pain manifests.
For sure.
Mm.
And I would even go as far as to say the same way that we need to normalize mental health care and mental health care seeking, which is what I mentioned earlier, we probably need to do a little bit more to normalize these various definitions of manhood and what it means to be a man.
Yeah.
I mean, I love that example too about the 6-year-old, because, you know, just imagine how differently that situation could have gone had that woman, I think the aunt, I think someone said that it was an aunt involved. Just imagine how differently that situation could have gone had that boy been exposed to other men who were emotive, who expressed themselves and their emotions, and not just the little boy, but also the woman herself.
Right.
You know, sometimes people don't realize that I'm so glad we're not face to face, because you all may throw tomatoes at me when I say this, but sometimes Black women are the worst culprits when it comes to encouraging Black men to be emotional or expressive. Sometimes we don't support that. You know, I can't tell you how many women I talk to who say, I don't want my husband to cry. I don't want my boyfriend to be, you know, a punk or weak. And so to me, sometimes we're the worst about trying to support these kinds of things. And so, like, this is what I love about where we are today in this work is we are better. We're better than we were, say, 10 years ago. But don't get me wrong, we still have a lot of work to do around how can we normalize multiple definitions of manhood and masculinity, various ways of men who are men and what we consider to be the epitome of manhood and masculinity, you know? So I like what athletes are doing. I like what a lot of celebrities are doing, just really pushing those boundaries around gender definitions and gender norms, really making people question, well, wait a minute, I thought that was a more feminine way to, you know, approach that problem. Or I thought that was not a masculine way to address that issue. You know, death and grief and all of that should conjure up some sort of emotion. And I feel like we just haven't normalized that as best as we could with Black men.
Yeah.
I agree.
And I'll be the person to say, you know, a lot of the systems of support, i.e. the church, okay, let's be for real.
All right now.
The church reinforces some of those stereotypical, archaic ideas. So,
amen. Amen.
Yes. and even just to pile onto that, there's also a little bit of duality in how the church looks at masculinity, because
absolutely.
So there's mixed messages coming from the pulpit, right? You know, it's okay if you are in service in a certain way, in a particular fashion, and if not, then it's not okay.
Yep.
So
that's right. Yep, that's right.
And I think all of this speaks to the fact that the change that needs to come about and is slowly coming about in the community has to be systemic. You can't just look at the Black male or you know, the Black woman. It has to be systemic, and it has to cross the age lines, because as we talked about before, we have this little Black boy who, you know, wishes to express himself, is expressing himself, but the auntie of a different generation doesn't get it.
Yep.
Yeah.
So educating the aunties and the uncles and the cousins and everyone in where we need to be, where we can be, where we want to be as a people is very important.
Yes. And then modeling becomes important too.
Yes.
Something that Dr. Watkins was touching on with NBA and stuff. Modeling, what does gender look like? How do we perform gender and it still be okay? How do we perform, not even perform, but how do we express our own emotions and it still be okay within the community, within the hood, etc.
Right.
Yeah, definitely. So I created this social media-based intervention that works to improve mental health, expand definitions of manhood, and increase social support for young Black men. And then oftentimes when we sit down with these young adult Black men and we talk with them about their direct influences, they always just take a beeline right to pop culture. They always talk about athletes and music artists and actors. And so, you know, we would be fools to think that they're not, getting something from that they're not getting their own definitions of manhood molded through who they see in the people that they admire. Now, certainly many of them also talk about family members and historical figures, but I mean, 9 times out of 10, they're going to name their favorite music artist or their favorite athlete. And so, you know, we can't just think that these kinds of influences are happening in the home. It does happen every time they pick up their cell phone and are going to follow the Twitter account of their favorite celebrity.
Yes, you're absolutely right. And one of the things I so appreciated and respected as a result of the devastating tragedy of Kobe Bryant's death and his daughter and the other people on the helicopter was we were able to see Black males grieve publicly, openly, weeping. First time in my life that I've been able to openly see that. And that, going back to the younger folks, seeing that being modeled was profound. Sit with that. You know, be inundated with that, if you will, for the most part, was something that was so powerful, and it gave many men permission to express and grieve.
Yeah.
And you know what's interesting about that as well is I couldn't help but think, as I'm watching my television and I'm watching these grown men, I mean, and kids and adolescents for that matter, as I'm watching them weep, I mean, weep, not cry, weep for Kobe Bryant. Yeah, you know, as I'm watching this, I couldn't help but think how many of these guys started out weeping for Kobe Bryant, but also shed a tear for their own loss, their own father, their own brother, their own cousin. And so I'm not convinced that 100% of those tears were for Kobe. I would argue maybe 30% of those tears were for Kobe, but you know, the other 70% of those tears was an opportunity for men to just let the floodgates open on all the loss they've experienced in their life. To me, if Kobe had to be the reason why they started crying, I'm okay with that. But just imagine how much healing happened as a result of those men just opening up the floodgates for a reason that was publicly acknowledged, a good reason to cry. One
of the things I notice in my practice, in my private practice, is that Black men are the first population, if you will, out of the different folks that I see, to cry in session. And usually it's that first session when they get permission to let it out.
They have permission and that space.
Yes.
And I think that one of the other things that came out of the tragedy with Kobe Bryant and the others passing was that his story and his life with his daughters was told in a way that it hadn't been told before.
Oh, yes.
That's a good point. That's a very good point.
To talk about it's okay to love these daughters in a way that's nurturing and loving and expressing that love. And I think that was something, that was a gem that really came out of that tragedy.
Yeah, for sure.
Yes.
So in talking about kind of where we've come from and where we are now, let's look forward. And I know that many of you are doing some great work in moving us forward with mental health within the Black community. And we are talking right now specifically about Black males. I'd like to start with you, Dr. Watson. I read an article entitled "A Light on the Path to and Promise for Black Men's Mental Health." And in this article, you stated a small but inspiring group of men's mental health, i.e. emotional, psychological, and social well-being scholars, are unapologetically working with and on behalf of Black men in the United States. And you talked about 3 major components or tenets of this effort. And I was wondering if you could speak to that a bit.
Yeah, so I'd be happy to. So that was an article that I was asked to write in response to some of the guidelines that were recently put out about how to do psychological practice with boys and men. And I just wanted to make sure that that kind of thinking was, you know, also being directed towards Black men and boys. And so I chuckle when you actually read that piece from my paper, because I was very intentional about noting that there are some scholars out here who are unapologetically focusing our work on African Americans. And, you know, being a researcher and a health educator by training, I just remember earlier in my career how I was discouraged from looking only within groups, like only within the group of Black men as the focus of my work. I was told to use a white comparison sample because they were the gold standard. And for some reason, we needed to compare what we did with Black men to white men as well. And so I, of course, aggressively pushed back on that. And so that's why in that particular paper, I was very clear about the fact that there are some of us, you know, definitely some of us on this call as well, who, you know, don't apologize for our focus on these men and feel like it's something that we should give our time and attention to.
Very much so. Dr. Lipscomb, we were talking earlier, I read your article about the Black male grief through the lens of racialization and oppression. And you talk about, you know, you stated that although Black males have experienced mental health challenges comparable to other marginalized populations, Black men dealing with the loss and trauma have a greater risk of experiencing severe mental health challenges than their white counterparts due to racism, classism, economic inequalities, and social political injustices that have been in existence since slavery. In talking about that, you talk about a way forward when dealing with grief and trauma. Could you talk a little bit about that, please?
Sure. There's a couple of things that I argue and encourage, even when I do trainings around working with Black men who are grieving, is that one of the things we have to do specifically in spaces and more intimate spaces like therapeutic spaces, clinical spaces, is speaking truth to experiences, recognizing and validating truth, racialized experiences, truth around gender, what they've been told to do, told not to do, becomes very important. Normalizing feelings versus pathologizing behaviors that we see from the larger community outside of the Black community. They don't see this as a mental health. When they see anger, irritability, that's an angry Black male. That's not someone who may be depressed, right? So recognizing what it looks like, and it may look different than, like Dr. Watkins was saying a moment ago, comparing to white counterparts, et cetera. Acknowledging more specifically systems of oppression, power, and privilege, specifically that show up in the clinical space, and speaking about that, and especially if you do not look like Black males in that space, acknowledging your privilege and your social location becomes important. Joining in the space with them and not, and this is very important, not hijacking their emotive experience in the space.
Yes.
One of the things that I have found and seen over and over again, folks, and this goes back sometimes, some of the situations, settings, Black women too, will hijack the emotive experience of that of the Black male. Maybe they're trying to rescue the emotive experience, trying to protect the emotive experience, or cannot tolerate to sit in the space and see and experience their man, Black male, grieving and weeping. I see this also with white folk working with Black men who talk about their trauma experience or their racialized experience, trying to make them, quote unquote, feel better, but inadvertently it takes away from their experience emoting in the space. So I tell folks, don't hijack.
Right. A great point. It's such a great point.
I agree.
The panelists are definitely inspiring me and making sure that their voices are heard. And I'm just curious to know what they think about the representation of Black males, specifically in the mental health field. I came across a statistic that cited only 3.7% of members in the American Psychiatric Association and 1.5% members in the American Psychological Association are Black. So I'm just wondering what, if the panelists can do like a quick temperature check on where we are with that, because if we don't have the models, it's very difficult for us to say, you know, we have our doors open, we're here to help you. So what do the panelists think about that?
Although we are seeing an increase, right, and specifically Black males getting degrees in psychology, social work, so on and so forth, marriage and family counseling, it's not to the same degree amount that we see other populations and communities, especially the dominant population about white folks, white women in the mental health community. And so one of the things that I have been tasked with is bringing this information and this research that I've done and other folks have done to train those folks too, because some Black males may not want to go to another Black male. And we have to be honest about that. Yeah. Because sometimes we embody and represent the person that they grew up, you know, negating their truth experience. So then how do I go and emote and let down to someone who looks like me? And I'll be quite honest, that's me. My therapist doesn't look like me, right? And I was intentional about that because I don't want to have to look at myself. I don't want to have to look at my kinfolk. I don't want to have to take care of you unconsciously, right? Unconsciously. And I don't want to have to worry about you judging how I'm emoting. So specifically, I looked for I looked for someone who had a critical lens, who I didn't have to explain stuff, but I could feel comfortable enough, and that's another important piece, enough to express what I needed to get out at that time or at the time I go.
Right.
It's a great point.
I'll say as I'm back in school, I'm working on a clinical psych degree. And first of all, where I'm doing my internship, my supervisor is a white male who during our introduction, one of the first things he said to me was like, look, I am open. If I say anything that's out of line, it's not on purpose, but I need you to bring it to my attention. I'm aware that I am privileged and I want to work on that. And I want to make sure that I am doing all that I'm supposed to do to support the myriad of people who come in. I live in Japan and we serve, for the most part, an expat community, and they're from all over the world. And so he wants to make sure that he is culturally aware, culturally sensitive, and that was important to me. Going back to what you were saying, or your question, Dr. Jackson, I think in some ways it's a double-edged sword in that it's exactly what Dr. Lipscomb said in a lot of ways. But the other side of it is that non-Black people also oftentimes don't want to go to a Black therapist.
That's right.
So then you have the Black therapist who has Black people who don't want to come to them for whatever reasons. And then you have non-Blacks who don't want to come to the Black therapist for their reasons. And so who are your clients? How do you make money? How do you help people? So I think a lot of times, even in getting these types of degrees, a lot of Black therapists or mental health workers go into different fields in order to, one, make a living, but also to reach a larger population of people and actually be able to help.
Yeah. Because I mean, not every white person wants a magical Negro to help.
That part. I had a white male tell me, he was like, I don't understand how you are still living. And I said, excuse me?
Ooh.
He said, well, you know, with everything that happens to Black men, I'm surprised that you haven't killed yourself or something.
Wow.
At the end of session.
Oh my God.
Wow.
Take that in. So speaking directly to what Dr. Hudson was just touching on, and what you were just touching on, Mr. Ellington, is this idea that I can't even reconcile how you're sitting in front of me, let alone I didn't pick you. My insurance authorized me to work. Let's be clear. Let's be clear. So
we're here now.
You mean I have to write a check to you? I have to write you a check right now? How are you even in existence?
Well, that that touches on an article I read by you, Dr. Lipscomb, that talked about microaggressions, and I can so many times, like I talked to someone over
that sounds more like a macroaggression to me.
That's huge.
Right, absolutely. So, so yeah, that you do run into those types of things as well.
Or you get, well, speaking of microaggression, let me give you a microaggression and let me give you another piece, another example. I had one person, another white male, say to me, and it's always at the end of session, folks, catch the cognitive dissonance. Now I have to pay you, so let me start saying I guess basketball didn't work out for you.
Oh.
So me being a doctor, me being a therapist, etc., is a step down. It's like my plan B.
Wow.
Because of course I went to school on a basketball scholarship. Of course, that was my number one. Right.
Oh.
Gosh.
Who are these people? Well, I mean,
Man.
That part. Welcome to the profession.
People you're meeting.
Welcome right. I always say to my students, I need to teach a class titled "The Shit They Should Have Taught You." Right?
Yeah.
Should have told you of what to expect. Right?
I think I agree with Dr. Watson. Run into a lot of macroaggressions, like
that sounds like a macroaggression to me. Yeah, but Dr. Hudson, at least your name's not Daphne, because when I walk in, they give me the you're black look. Oh, you're black. Oh.
Yeah.
Yes.
Daphne. Oh, that's an interesting name.
Yeah.
Yeah, I agree. So I was wondering if Dr. Jackson, if you could talk a little more about thought work, because that's definitely a way forward in working with mental health, especially in this community.
Sure, absolutely. So as I explained before, the concept is really given to us from the field of cognitive psychology. And the underlying principle here is that no one teaches us that we really have the ability to choose what we think. These thoughts pop into our head, and because we hear them in our own minds, we just automatically assume that they're true. And after I discovered this work and I began to practice it, I started learning ways that I could really just kind of break the think, feel, act process apart. And if I could look at situations through a different lens, I could choose thoughts that helped me feel the way that I wanted to, that motivated me to take actions to get the results that I wanted. So it's a core belief and core philosophy of what I do when I coach students, when they're taking online classes, that, just because you think you failed the first test and you're not going to pass this class doesn't mean that thought is true, right? That's a thought error. So when we were talking earlier about how these thoughts that no longer serve us in the community about Black male masculinity, that's like a massive thought work project, right? That's a thought work project for the world, right? Because that it just goes beyond our borders of what it means to be Black, but it also kind of, gets into what others think about what it means to be a Black male. So I believe that this concept is something that is empowering. I think that when we start really unpacking like what's driving this thought, and it's usually a situation or a circumstance that we believe is positive or negative, and how do we take that and neutralize it so that we can be curious about what are our true abilities. So what if I don't think this thought and I choose a thought that's probably a little bit more neutral and fact-based? Okay, I didn't pass this test. It means that I can do better on the next one. Right? That's objective. I have the possibility of actually passing the next test if I make some changes. And I believe that when you work in that space, you create the energy that really pushes you forward to make and enact change and take action that gets you to the desired outcome.
Mm. And it is kind of like right now, brief therapy, and it can change. You can change a thought within a short period of time. And, going back again to the example that Mr. Ellington gave, if you did that process with the auntie to get her to think about, why do you think that way? Where is that coming from? And what if we change that? And we looked at this child in a different
Right.
way. That
Right.
changed
And those, yeah, I think the perfect question in that moment for that auntie would have been, I don't want him to cry, and just to come back, well, why is that such a bad thing?
Mm-hmm.
And she'll probably come out with a reason, and you hit her again. Well, why is that such a bad
Yeah.
thing? And she'll come out with a reason, and you hit her again with, well, why is that such a bad thing? So essentially, you work her down to the process of realizing, well, maybe it's not such a bad thing that he cries.
Right.
You know, so I think that this work is it's important. It's useful. It's something that individuals can learn on their own. You don't have to, get a degree in this. This is not what my degree is in, but it's truly a concept that I've embraced, and it really has changed my life. That mental chatter that we always have, whatever that little voice in our head is that's telling us that we can't. I'm learning how to tell that little voice, blow off. That's not true. You're trying to trick me into not taking action. So I'm going to try to think about an idea or a belief that really gets me motivated to do the thing that you're telling me that I can.
Yeah.
I know I'm not the moderator here, but what I'd like to bring something up as far as the whole COVID-19 thing.
Yes.
I feel like that has exacerbated a lot of things. And we haven't really, we kind of mentioned it, but we didn't really talk about it. And that's one thing that I'm seeing in my work, because now I have to call people as opposed to visiting them, right? So I would typically be in their homes and talking with them. But the levels of stress, with a parent who is now having to basically homeschool children while they work from home, or the parent or the caregiver who has just been laid off, right? Who now has the children at home who are working on their computers and dealing with them all day long, and then the grief. Actually, the grief of not being able to connect with the people that they usually connect with, and the fear about what can happen, and then the health issues. And so there's layers upon layers upon layers. And as far as Black males, there's a lot of stress. And, and it's not just Black males, but males in general. There's a lot of domestic violence happening. Right. A lot of children are being abused. A lot of things are happening, and things are being exacerbated. So I wanted to just ask any of the panelists where they are with that, and as far as dealing with some of those things.
Sure. I know for me, I am like Dr. Hudson. I'm doing telehealth right now.
Yes.
Practice. And I have been doing a lot of coaching around productive self-talk for folks, going back to what Dr. Jackson was touching on. And so it's not so much the traditional like positive self-talk and all that stuff. It's, did you get out of bed today? That's productive. Yes. Did you do a load of laundry? That's productive. Did you walk outside? Did you wash the dishes? Did you whatever? So shifting a little bit around what is working for you that you're doing, and let's focus on that, because this is unprecedented. This is new territory, but how do we keep you cognitively functioning, that doesn't begin to overwhelm your psyche, and then physiological responses as a result of that.
Yes. Okay.
Dr.
So I'm not a sure. So I'm not a therapist. I only play one on television. So I often tell people that I'm definitely not a clinician by training. And so my work with Black men tends to be more community-based, community-anchored kinds of projects. And I think I alluded earlier to my online intervention that I've created through social media for young Black men. And so what this COVID-19 matter has raised for me is the need for more of those kinds of spaces. Particularly because the program that we had is not e-therapy by any stretch of the imagination. It's just a community. It's just an online community where we share mental health education resources about Black masculinity, Black manhood, and also resources about social support. And so for the men who may not be in a space where they're ready to have those face-to-face, of course we can't do that now, but when back then, when guys didn't feel comfortable having those face-to-face encounters about their health and well-being, about Black manhood, this kind of online forum was perfect for them. And I think it still can be perfect for other people. The beautiful thing about the internet and about social media in particular is that men can change their profile name. They can change their profile picture. And so there is something about that anonymity that literally just opens doors for some men to be able to really speak freely about how they feel, what they think, what they're struggling with, and things that they still haven't had a chance to figure out. And so what this COVID-19 has done for my team is we have kicked into full gear now, trying to say, oh, wow, here we thought we just had something that was very sort of easily accessible and nice for guys to come should they decide they want to. But given the pandemic, we're realizing that this may be a necessity for some Black men. And so this may not be no longer an optional program, but some guys are going to need a very safe space to unpack some of the things that are happening in their lives.
That's right.
So we're trying to roll out a few more of these iterations in the coming weeks.
Yeah.
Beautiful.
I think that even thinking about how people are in general are dealing with, having to be inside and all of the different activities and happenings that Mr. Ellington mentioned. Another big issue that I'm finding with the people that I'm working with is learning how to be with yourself.
Yes.
Yeah.
And for some, it's scary. For some, it brings about anger. Some, it brings about stress, anxiety.
That's
but being with yourself and your thoughts, like helping them learn to do that process.
Very well said. Yeah. Very well said.
And accepting all those feelings.
Yes.
Accepting all those feelings.
Yes.
All of them. And
I that's the process that I use, not just with Black males, but with anybody. Because I think that our gut reaction is that when a negative feeling arises or a negative thought arises, we try to push it away.
That's right.
Right. Guess what? We are human beings. We are meant to have the whole range of the human experience. You're going to have good days, you're going to have bad days, and you need to lean into it all and in the space between. Right? So you have to start getting comfortable with what's going on, whether it's good or bad. You got to go through that, because the more you try to repress it and push it down, the harder it is to get past it. So the resistance doesn't work. You've got to lean into whatever is going on and get comfortable in that space. And when you're ready to make action, then you can move. But you can't do that without going through the experience first.
Yeah, because we're not immune to it, right? We're not some kind of a super power or anything like that. What did Jesse Williams say? I liked his quote years ago. He said, "Just because we're magic doesn't mean we're not real."
That's right.
Yeah.
Right.
Always love that. Always love that quote.
It's everything.
And you think about the fact that, like Dr. Jackson said, we have the spectrum, the whole range of emotions, but then you take a time when Black males are quarantined in their homes and they've only been taught to emote in this small section of the spectrum, but they're feeling all of them, and now they're alone with all of them.
For sure.
How do you how do you do that? How do you deal with it? And learning how to process through that. Yeah, definitely. So are there any parting words or thoughts that you have about this topic, about Black male health, where we're going with it, where you'd like to go, or anything that you're currently working on?
I think I'm inspired, not only by our conversation today and the panel today, but I'm also inspired about what I'm seeing in the community and what's being done and conversations that are taking place. And going back to Dr. Watkins' point earlier, people who are unapologetic Black scholars and researchers, that's bringing about a shift. We're also in the middle of a shift, being that we're in this pandemic. But I am still ignited. I am still ready to do the work with Black communities, Black folks, and specifically Black men. So that's where I'm at with it.
I too am delighted by being able to engage in this conversation. And I think that this is a conversation I want to continue in the work that I do. And just a big thanks to the scholars and practitioners on the panel for what you do. I'm sure you don't get a lot of awards for this, but this is really important work to the Black community, and especially for the work that you're doing to empower Black men to really get comfortable with being in their skin. So thank you so much for all of the work that you do in your individual roles.
Thank you, Dr. Jackson.
Thank you.
Yeah, sure. So my 2 cents is that I just wanted to thank you, Dr. Hudson, for bringing us together, because I think, these are the conversations that we should be having. And I echo the sentiments that they need to continue. And so I'm thinking we might need to start a little Slack channel or something where we can be talking.
Definitely, yes.
Because this work cannot be done in isolation, and there's still so much that I don't know and so much that I'd like to learn from these guys. I'm just really inspired, but also, I think the phrase that comes to mind is that the future is bright. To know that these people on this panel are the folks that are at the front lines working to improve the living and learning, and just the happiness of Black men really makes my heart glad. So thank you for the opportunity.
Thank you. And Mr. Ellington.
Yes, thank you for making this happen. And I feel really good about the future, in spite of the chaos that we're in the midst of. But I felt like I was like the one guy in the Avengers that doesn't have superpowers while I was sitting here on this panel with all these superheroes. Like I'm the guy without the I got to do some special training and stuff. Hawkeye. I'm Hawkeye. I'm the guy with the arrow. I'm Hawkeye. Everybody, we got the Hulk. We got we got Iron Man. We got Storm. We got everything.
I love it.
Well, I have truly enjoyed this panel, and I do feel inspired, and I feel like we're in a good place in spite of, as Mr. Ellington said, and I think that we're heading towards even better things. I feel like you guys, I would love to have another panel and discuss some more and discuss some other topics.
Sure.
This was great. Thank you all for agreeing and for being here and for adding such great insight. I think whomever listens to this will get some good information and be inspired as well. So thank you.
Thank you.
Thanks.
Thank you.
Thank you.
Zen'n'ish copyrighted podcast and website represent the opinions of Dr. Lakeisha Hudson, Dr. KiKiin Zen'n'ish Incorporated, and or her guests. The content here should not be taken as medical, psychological, or any other advice. The content here is for informational purposes only. Please consult your healthcare professional for any medical, mental, or health concerns. Views and opinions expressed in the podcast and website are Dr. Hudson's and or her guests and do not represent that of their places of work. While we make every effort to ensure that the information we are sharing is accurate, we welcome any comments, suggestions, or correction of errors. All people and places mentioned in the podcast have been changed to protect confidentiality. This podcast or website should not be used in any legal capacity whatsoever. No guarantee is given regarding the accuracy of any statements or opinions made in the podcast or website. In no way does listening, reading, emailing, or interacting on social media with our content establish a doctor-patient relationship. If you find any errors in any of the content of the podcast or blogs, please send an email to 423.4.dr.kiki@gmail.com.